We need to offer a care option that makes sense in the context in which that animal and person live together. If we can switch our training focus to challenge-based, hopefully we'll have a lot more satisfied practitioners.
Welcome to Vet Life Reimagined. What does it really mean to provide the right care for each patient? In veterinary medicine, you might be hearing and seeing the phrase spectrum of care, but our guest today invites us to think about it as contextualized care, care that is patient-specific, family-specific, and rooted in real-world circumstances. And we challenge that this shift will enhance patient well-being, client relationships, and our own job satisfaction. I'm joined by Dr. Kristin Jankowski, a veterinarian who spent 25 years in general practice and community health and is now at UC Davis. When she was in private practice, she helped start One Health Delaware, a program that connects human and animal health care to serve families more holistically. And today, she's also a leading voice in the AAVMC's Spectrum of Care initiative, helping veterinary schools and practitioners alike reimagine what accessible, sustainable, patient-centered care can look like. Not everyone in our profession is familiar with spectrum of care yet. It's still a growing concept across general practice, specialty medicine, and academia. But Dr. Jankowski's perspective and stories bring it to life, showing how contextualized care empowers veterinarians, strengthens relationships, and expands what's possible for both pets and people. If you've ever wrestled with balancing gold standard medicine and real-world constraints, this is an episode for you. So let's get to the conversation with Dr. Kristin Jankowski. When did you know that you wanted to get into veterinary medicine?
I was one of those kids that knew right away. I think I was about 6, and that's all I wanted to do was be with the animals and study the animals. And in fact, I still have this piece of paper that my mom gave me with a bunch of questions about, like, what do I want to be when I grow up? And that was what I put on there, to be a veterinarian. So I knew very young.
So you have proof that
Yes, I
from
have
a very young
proof.
age.
Yes, still in a frame. Yeah.
Oh, I love that. Well, very cool. Well, I just think, childhood and where we come from is a big part. That's a great story in itself.
Yeah.
But is there another story that kind of comes to mind before you actually get to vet school? Like, is there something that kind of maybe solidified that, yes, this is the path, or just something that's like a fun story?
Yeah, I mean, definitely my whole childhood, I think, was prepping me for this because my mom was a wildlife rehabilitator, and she was also a teacher that worked teaching math in underserved communities. So I think I brought all of the love of those types of things together. But when I went off to college, I wanted to be sure that it was what I wanted to do because I'm pretty sure, and I've thought I've wanted to do this since I was 6. So I think about my 3rd year in undergrad, I decided to work both at New Bolton Center, which was University of Pennsylvania's large animal hospital, and I did a night shift full sitting. And I also worked for the DuPont company doing, I was a chemistry major in college, so I did chemical engineering experimentations and things as an intern. So I did them both at the same time. And nothing against the DuPont company, but that really cemented, I was like, wow, working directly, doing the one-on-one with the animals for sure was what I wanted to do. So that summer was super helpful.
Yeah. It is hard to beat foals. So
It is hard to beat foals. I mean, and I became a small animal practitioner, but I still have the love of horses and still do that when I can with my own time. So yeah.
fantastic. And, I think those types of experiences are so important from young age to vet school, because I think we don't always know what we don't know. So when you went into vet school, did you think vet life would look one way for you? And did that change at all as you went through vet school?
100%, because I started out wanting to be an equine practitioner. I was just a horse crazy girl that begged, borrowed, and stole to do anything with horses. But then once I got into it, I realized that I truly loved the companion animal medicine. And I still want to keep the horse thing as a hobby and a love, but to do the medical workups and surgery, I got to do a larger range of things with small animals. So I found that that was my professional love, and I could still keep my horse love as the hobby. Yeah.
Yep. Very cool. Well, any particular memory from vet school too? Because I think
Mm.
we all have some fun memories from vet school, and those are also fun to share and bond over. Any fun
Yeah.
memories that popped up?
I mean, definitely. I went to school at the University of Pennsylvania, so I think I was really lucky to experience a huge range of clientele and patients and things. Being in West Philly, we saw all kinds of things from gunshot wound victims to infectious disease to chronic disease. And I think just being in a big city had a huge caseload. I definitely remember some of the medicine cases and loving those, but always looking for an angle for how we could provide, even at that time, more care, wondering, did we need to do all the tests or did we really have enough information just from a small sampling of tests and our exam and our history and, all those things. So I even remember those instances of just thinking through, like, could I do more for folks that couldn't do all of the highest technology options? And then I also really loved I remember getting called in for a pyometra in the middle of the night and just how formative that was to be able to really get in there and do pretty complicated surgery, but that is considered, it's a routine surgery really. So, and just them making it like, no, this is a routine surgery. The uterus is just bigger, but yep, we're doing it in the middle of the night because this one's a little critical. So yeah, so I think just normalizing those things too, like, yeah, you can do it. Study up, do it with someone who's helping you first, and, make sure you know when to ask questions and when to ask for help, and then you need to be bold, So I remember a
Yeah.
bunch of those things of just having those opportunities during vet school to do that, which I'm really appreciative.
What we talk about today, that a lot of vet students just get this ivory tower perspective of
Mm.
like, this is do all the tests and all of the things because people who come to the vet school, they've been prepared for that. And I mean, back in my day, I still remember
Yeah,
that we had diverse cases, that not
for
everybody could
sure.
do
Yeah.
absolutely everything. So that's good that you were starting to see that, and also see the empowerment from a general practice standpoint as well, which is where you ended up going and
Yeah.
for a very long time.
Hmm.
And you told me that you feel very lucky that you found a practice that continued that culture and that mindset
Hmm.
of working your cases and not referring everything. So do you mind sharing how you got your first job as an associate veterinarian and your experience there?
Yeah. So my first job was like many, where I went into a super busy group practice, which was awesome because we saw lots of cases. It was a super crazy schedule, but saw lots of things with great mentorship. So I had good mentorship for doing just general surgery and stuff at that time. But I did find that I really loved the interpersonal part of it right away. And I wanted to have more connections and see my clients more regularly versus seeing a ton of clients and never seeing the same one again. And so I sort of quickly transitioned. By a friend of mine from vet school had an opportunity. She was older than me, and she reached out. She's like, "Hey, we have an opening in our practice. We would love to have you. Are you interested in coming up?" And then I got to start to work in some of those long-term relationships. And over the years, I ended up at a practice like that where I really loved. I was there for 13 years, just knowing my clients really well, being able to know the pets really well. And I feel that that was super formative. And then just having the mentorship to keep studying, keep doing more, go to those labs, go into dental labs and being more comfortable with dental surgery, maybe, have a lot of capacity to do that, which is, we know, is a huge need in our profession. And I just kept learning. I loved always doing more learning, but still bringing that back to my companion animal practice. So I think that combination of mentorship, camaraderie, keeping the schedule manageable was also good. And the balance, where I had kids along the way. So they were super accommodating, where I was like, hey, now I need to change my schedule because my kids have this activity or that pickup time. And I was super lucky to have them be able to say, we hear you and we want you to be happy. So let's work with what you need. And we know you're going to work really hard when you're here. And I was also super lucky that my husband was a veterinarian. And so he is a small animal surgeon. So we could juggle our schedules because the veterinary world was really complementary to that, where we didn't work every day of the week. Sometimes we would work a 12-hour day and my husband would manage the kids or vice versa. So I think we were really able to keep a work-life balance, family balance that was so doable. And I think that kept me really going through the years and always inspired me to still want to do more rather than pulling back. I was like, what can I do next? And so that was, I think, made it fun. And I feel lucky to have been in a time where we were encouraged to do more. And like, if we were going to refer something along, make it a good referral, but, offer the clients to do as much as you feel comfortable with and, tell them together, like, we need to look at this together and I need to look into more things if you don't know, just being really upfront and including them in all the decisions. So I was lucky to have that.
First of all, it's always great that you feel safe and comfortable to ask for those things, right?
Mm-hmm.
I don't know if all cultures maybe help people feel that comfortable to say,
Mm-hmm.
"Hey, I have kids. Can we be flexible? What do we think
Yeah,
could work?" Right?
right. And I would tell the younger associates when they would come in that all the time. I was like, you need to try to find that balance, but speak up for what you need in a way that's fair. You want to be like, I'm all in and I can give you 110% of my attention in whatever range of time that you can work. And then, if you need to be checked out and, on home duty or whatever it is that you do in your other time, sticking to that, and just establishing boundaries that feel fair, like you said, and feel safe. And I was just super lucky to have that ability. And I hope that still is a culture in many places today. But when I worked at Limestone Veterinary Hospital in Delaware for many, many years, and I was able to have that awesome relationship there. And I think when people do speak out for what they need in a way, it's just like any relationship. You need to use communication, whether it's with your sister, your husband, your, whatever. You need to speak from the heart with what you need and then listen to what they need and truly pause and then come to something that's an agreement that both of you like. So,
Yes. And the other thing that I heard that stood out to me as well is that personal growth part of it
mm,
too.
yeah,
Know what you need, right, for
yeah,
home.
yeah.
Also, if you're interested in something, really encouraging people because it's always fun to hear people's perspective, right?
Mm,
Especially from general practice,
mm-hmm.
because, not too long ago, I heard, general practice, it was dental, vaccine, dental, vaccine, and they got bored. And it's like, well, you know, did you feel like you had the opportunity to go and grow and learn and do different things? And like you said, keep your cases. So you're not
Yeah,
just doing dentals and vaccines, but you feel
right.
comfortable and confident to keep your own cases. So it is more stimulating and things like that. Any thoughts around that?
For sure. Fast forward a bit, and I'm sure we'll get to this. When I was at UC Davis teaching primary care to students, I would encourage them all the time. I was like, just if you keep growing and learning, general practice is, I think, one of the most challenging and rewarding things out there because of the range of work we get to do. You can spend more time learning about oncology and offer your clients if they want to do the lymphoma patients with you and if they feel comfortable with that. And the next referral oncologist might be 2 hours away. So they might want to keep it with you. And then keeping that relationship good with your oncologist so that when you give them a good referral when they need it and you offer your clients options. So, I mean, because we have the range of doing everything from like we said, internal medicine, oncology, dermatology, surgery. And, we never want to do more than we feel we're competent with. But if you continue to study, it's amazing what competence you can gain. And then just keep your relationships with your specialist so you can say, hey, this one's out of my comfort zone. I'm going to refer it to you. What can I do to help make it a good referral? Like, what else do you need before I send them to you to make it so you're not stuck doing things you don't want to do? And they're like, great, do this, this, and this. I'll handle the rest. Perfect. So I think you can make it as challenging and exciting as you want, but also you have the opportunity to make it boring. And we're like, that's your choice, but I wouldn't do that. Like there's no need. I mean, when patients come in and they're there for a vaccine appointment, you often will find other things or just talking about preventive care, like talking about If you start brushing your dog's teeth now, you may save thousands of dollars on a dental and a lot of discomfort for your pet. And, the student's like, oh, I never even thought just a simple conversation could really help my clients and the pets avoid a lot of things that are super negative, and just the power of all those conversations that we can have about keeping your pet a healthy weight and how they can live 2 years longer. And isn't that so cool? And if you just think, well, they're just here for the rabies vaccine, but you don't address that it's a body condition score of 7 out of 9, you've missed an opportunity that makes your day more interesting. Number one, that helps your client understand a little bit more and give them the power of choices. And of course, helping the patient is the ultimate goal. So there's always some sort of preventive care to be discussed, even if you don't have a problem-based appointment. Not that you have to spend hours on it. You need to move on to the next patient, and I totally get that. You've got to be efficient. But I think just even those inquiries of just rather than rushing through, taking a moment to be like, what other questions do you have for me? And then just truly waiting and saying, because a lot of things will bubble to the surface. Like, well, I did notice that my dog has been scratching more in this one spot, and I didn't want to bring it up because I kind of forgot until you asked me a little bit more. So, really allowing the conversation to evolve will provide better care. And it's more fun. It's honestly just a lot more fun.
Well, I know that when people think about getting more education, they might think reading papers or going to conferences. What were some of the ways that you got additional education that you enjoyed, and maybe even anything unique or something that you did that maybe not many people would be thinking about to kind of grow themselves and their knowledge?
I think the things that really helped me the most were doing some of the interactive labs that you can do. They either can be offered sometimes through a university. I did a dental lab on even just doing local nerve blocks and basic extractions just to get better technique. And then I did some like sports medicine labs at was NAVC, but it's now VMX. And that really got me interested in rehabilitation. And then that spurned on a whole additional chapter of my life where I got certified in canine rehab. So I think just finding those things, like following your passions, like, I was super interested in sports medicine and pain relief. And I was like, oh, there's a thing you can do with that with rehab. Most places are going to have continuing education funds. Pick something that seems exciting to you and then just keep going. And then certainly finding things that are free. I went to like every free sponsored, industry sponsored, specialty center sponsored CE event for the free food, chat with your friends. Oh, and learn something, and then sometimes that learning something really was like, wow, that was fascinating. The new studies on, pimobendin extending life when you're selected for the right patient. So I still actually remember learning about that. And I was like, that is so cool. So I just really enjoy learning. And I think most people that go into veterinary medicine do. I mean, that's just we're self-selected for that. So I don't think I'm so unique. And it keeps it more fun. It's like anything. I like to do that with my hobbies too. I'm always like continuing to get, training on whatever I'm doing because it gets boring if you're doing the same thing. So a little bit of challenge keeps it fresh. And there's actually studies that our brains work that way, that we need it to be different to be engaging and fun. And then for me, it was translating that then to students when I was doing teaching and working even with their own practice. I was frequently the one to set up training seminars for our technicians. Like, do you want to learn how to read ear cytologies better if we had a slow day? Let's do that. And they were like, this is fun, and so paying it back too. So in your practice, if you really enjoy the trainings, providing those, even if they're on the fly, like, let's look through this radiograph together. Like, I know we could send it off to the radiologist and we might still send it off to the radiologist, but before we send it to the radiologist, let's look through it together and see what we find. Because if we start resting on our laurels and sending everything out to some technology site to do it, you'll lose that skill. And that's something that is, once again, is enjoyable to have skills that you can use. And technologies sometimes fail us. The computer gets shut down or you can't get to your radiologist with your connection or whatever. So you don't want to lose skills because I think that is valuable to your client, patient, and you as a provider. So
Nothing is 100%. So it is good to at least have enough knowledge to be able to say, are you sure? Yeah, exactly. Well, and then you mentioned this, that you are already starting to noticed your interest in access to care and things like
Mhm.
that, even in vet school.
Mhm.
But you also were exploring like One Health and other things as well as you were in practice. What other things did you start to do to get more involved in that side of things?
Yeah, so as I mentioned, when I went back and I was doing the canine rehab for a little while, I was working in general practice and I was working especially practice doing rehab. And at the same time, I also started to get involved with my local animal shelter, and they asked for me to be on the board and help out. And then that's where I was in a community outreach group, and we were charged with trying to see what we could do to help our community. And it was actually coming from a specialty center appointment where I was dealing with rehabilitation of, I think, a post-surgical issue, and with very, high income clients, and then driving through the lowest income part of our state to get to the board meeting and realizing like, wow, there really is a lot of disparity in the health opportunities. And I thought, if it's that way for animals, it's got to be magnified for people. And that's when I started to get more interested in how could we connect these things? How could we connect opportunities for people and pets? We know people really care deeply about their pets. And the general practice I was working in served a huge range of clientele. And I had several episodes where clients came in and said, I have this medical need for myself, but I'm putting it aside because I need to address my pet's health first as my first priority. And I was like, wow, that's a hard decision for people to make. And although I can't tell them how to make their own decisions, I was wondering, could we offer situations where people weren't forced into that decision process? So couldn't we have them have opportunities for themselves and their pets? And that's where I kind of came up with the One Health idea. And then just with a huge team effort, we managed to get a One Health clinic off the ground with lots of collaborators who also thought the idea was interesting. And it was just so amazing to see the power of that human animal bond, and then have people start to talk a little bit more about their own stories of health, and then have the nurses kind of help intervene. So it was really a fascinating chapter, and it taught me a lot about how healthcare is for pets. We really need to contextualize it, right? Like, we need to offer a care option that makes sense in the context in which that animal and person live together. And sometimes those contextual things are related to finances, but not always. It can be lots of other things. So I think that was a very eye-opening experience for me. And it not only brought in that part, but it brought in where I was doing more teaching with the students from University of Pennsylvania when they were joining the project, and University of Delaware was in on the project, and the nursing students from Wilmington University. So it was a big discovery for me that not only could I combine access to care, helping people and pets together, but I could teach at the same time, which was incredible. And so that was like, okay, that's going to be the next chapter if I have anything to do with it. So, and that's what I started looking into.
Yeah, definitely opened up your network for sure, but
Mm-hmm.
love your perspective on that, your ability to look around and see needs and be creative on what could we do here? I
Mm-hmm.
think
Yeah.
that's really special. And looking at the dates, this was 2017 to 2020. And I think a lot of people think about more of that, oh, people start petting their pets above themselves was kind of like a pandemic-y thing, but I don't think so. That maybe that
No.
just inflated that they were home more together. But
Yeah.
that perspective has been growing, I think, for a long time, just getting stronger and stronger over time. And maybe you've gotten this, but I love stories, and I just see a potential opportunity to ask for a really neat story during your time there. Was there a
Yeah.
particular case that you still kind of carry with you today?
Were so many, but one that I really hold dear to my heart, and I would share it regularly with the UC Davis students in primary care because of how much it meant to me, was where a mom and her son and their dog came to the One Health clinic as mostly for preventive health care, like they were presenting for. And then she also mentioned that the dog was having some limping and trouble getting around. And so we did an exam, and we could palpate some decreased range of motion in the joint. You could palpate a little crepitus in the front limb. And so it was cool to even just talk to the students about, like, what you can learn from an exam. We didn't have radiographs or anything on site, but kind of offering opportunities for, what are you getting from the history exam? She's telling us about the dog having trouble going down the stairs. We're palpating crepitus, decrease in range of motion in a front limb. You can say pretty likely you've got some osteoarthritis there. And certainly you need to rule out neoplasia and other things like that. But, we explained to her we didn't have radiographs, but we could offer some nonsteroidal pain medication. We didn't have full lab work, but we could run a urinalysis and check a urine specific gravity, so we could do all the low tech things that truly give us actually a lot of information. And so we sent the dog home with some carprofen, and honestly, I didn't think too much of it. And we were like, that was cool, and on to the next thing. Until she came back the next month and she pulled me aside and she said, I just wanted to tell you that my dog is doing so much better, and that I was really distraught because I didn't know how to help my dog, and I felt really just tied. She's like, I'm a nurse, but I had lost my job, and that's why I'm here, because I didn't have opportunity for care. And she's like, actually, my son is autistic, and so I was really struggling to deal with my personal issues and my son's issues until I could get my dog to be pain-free. And she's like, and the fact that you all really listened and kind of went over and beyond and then offered something that truly helped alleviate pain, I could think about the rest of the stuff in my life and start to deal with those issues. And I couldn't before. I was like, wow, like that was like, it seemed so simple what we were doing, but really just provided a whole new avenue for this lovely woman to feel empowered and make some changes that really helped her for such a tiny thing. So I would tell the students, like, look how small your effort was in that, but it was super meaningful. Like, you didn't say like, well, I can't do radiographs, I don't know what's wrong, and see you later. It's like, well, we really had to think through the case and give her a lot of options using that relationship-centered communication and truly listening and checking in and all those bits. But it was so powerful for something so minimal. And I had another story where a client, we were just doing a routine exam and checking in on how the dog was doing, and the nurse was hanging with us, the human nurse, and they just started asking, one of our history questions was whether anyone in the house smokes or if the pet is exposed to any secondhand smoke. And then it immediately started them to share a story how they had started smoking again after they lost their son in a car accident. And it has been a really rough time, but they're like, knowing now that it affected their dog negatively, they're like, we would love resources because we want to know how to stop smoking, and feeling like we're getting our dog healthy again makes me feel like we made them feel like they wanted to keep that trajectory going and then help themselves. And so the nurse was able to kind of just be there for them and say, hey, I'd be happy to help you with some resources. Like, what a powerful moment, for them to be like, to be vulnerable enough to say, our lives have been really hard and it made us pick up habits again that we wish we didn't have. And because we're all here together as healthcare providers, we could facilitate something that didn't feel so scary. It didn't feel like, oh, I've got to go and tell my doctor I'm smoking again and admit to that. And now I've got to fill out 5 forms, or 8 web pages later, I get to a resource versus someone being right there. So, I mean, and I have like a zillion stories, but those are some of the ones that come to mind when you first asked. But that's what's amazing, I think, when you take and really listen to your clients, and you can involve the One Health piece. It can be truly magical what can happen when professionals can come together to serve the client-patient pair in a more unified way as a unit, as they're a pair, right?
Very much so. And my vet school is coming back to me where they said the history and the physical exam are your bread and butter, right? It's like, if you have that, you've got most of what you need. Mm-hmm. And that, I mean, your education gets you that. And so what seems simple after all that education and that you can offer is some pain management. And that made the world of difference for the entire family.
Exactly. And I mean, how easy is that?
Listening to these stories, how can you say general practice is boring? No.
Right.
This
I
is
mean, and that's the thing, right? It's just over and over. Every day is like that. A new exciting opportunity. I mean, I know that's the way I feel about it. So, but I think when you start to really get into it like that, you're like, oh, it can be like that. Like it can be every day is a new opportunity. And I still remember my mom, she would still ask me, she's like, what are you going to do at work today? I was like, I don't know. And that's kind of the cool part. I don't know. Like it's going to be a mystery and I'll figure it out when I get there. And so I think if you are a person that really enjoys challenge, and they're doing a lot of interesting study about that now, actually in the UK, where they're studying like, are we training our students to be challenge focused, which then you're like, oh, cool, it's a puzzle each time. And I'm going to try and figure out the best option for this particular client patient pair and me as the provider, versus are we training them to be diagnosis focused, where you must get a single right answer. And if we're training them to get the single right answer, then it can be really frustrating if for whatever reason your client doesn't have the resources or your patient can't tolerate the testing or whatever, and you have to just narrow it down and get to a plan that seems reasonable and, use your evidence-based medicine whenever possible, but still you might not get the exact answer. So if we're finding that if we can switch our training focus to challenge-based, hopefully we'll have a lot more satisfied practitioners who are like, I don't know what today is going to bring kind of challenge, and I'm going to do the best I can with what I have in the situation within where I am today. That will help with longevity of those in our profession. Like if you have a challenge focus. So they call it professional identity, and how we're, taking in all the pieces that form our identity. And that's one piece of it, the challenge versus diagnosis focus. So I think general practice really embodies that if you love the challenge focus.
Yeah, and back to job satisfaction and feeling like you're making that impact is that mindset of every case, there's potentially multiple answers, right? There's
Right.
multiple possibilities. And again, thinking of it that way, it's like, what are the possibilities? What are, the challenge, and how can we work together with the pet parent to make sure that we are coming up with a good solution that everybody feels pretty okay with that,
Yeah.
when they go home. So you feel okay when you go home too.
Yeah. And that's where it loops back to kind of what I've gotten into more recently, is working with the AAVMC and the Spectrum of Care initiative. With the task force, there's veterinarians from all around the world who are coming together to try to see how we help schools to have this type of focus on contextualizing care and making it a spectrum, and helping support veterinary teaching programs on how to teach that, which has been fascinating because it's a process to make change in higher education for sure. But there's a lot more evidence to back it up and a lot of tools that are coming out of that. So it's been an exciting project.
Yeah, so let's tell that story. It's very evident. A lot of this comes up with examples of you teaching. Like that's something that
Yeah.
you seemed to really enjoy. And so I think there was an opportunity I think you said your husband was at a point, I was like, we can move.
Yeah.
What do you want to do?
Yeah. Yes.
And you're
Yeah.
like,
So
I'd love to
right.
teach.
I want to teach.
So
Yeah. So when he sold his practice in Delaware, we finally had the opportunity to move. And I said I want to teach. And I had already done some work with UC Davis, consulting with them when I was trying to start One Health Delaware. And I loved it and thought that that would be an amazing place to be. So a job came up in the primary care teaching. It was called community practice at the time. And I was lucky enough to get the job and came out. So I was, very involved with kind of everything we've talked about, just teaching students how to be practical and challenge-based, and still very much interested in providing access to care. So I started doing more with that. And I was lucky that the university was starting to realize that that was an important field to get involved in. And so they gave me some little additional time to work on that. And fast forward a few years, and then I was invited to join this AAVMC's group on Spectrum of Care because I was very much curious about Spectrum of Care, and I could notice that our students seemed stressed, honestly, when they didn't have all the technology to go the next steps. And I think it was just the evolution of kind of what happened in our field, that these higher technology options were out there, And so they're exciting and then a part of the teaching. And then what's happening at the universities are, like you mentioned earlier, is that clients are seeking out that higher technology care coming to a university. So they're sort of self-selecting, and then the students aren't seeing the range. So they're not seeing the clients that are coming in with a range of, finances, ability to travel, language differences, things like that. So the educational system just got a little narrowed. And I think coming in as an outsider, it was easier to see that because I had been in general practice for 25 years, seeing just sort of normal, quote unquote, clients, not seeking tertiary level care every time. And so I was able to notice like, wow, we're not maybe meeting all the needs of the students. We're teaching them fabulous stuff about research and high technology, but maybe we're not meeting their needs across a range of care. And I think there were a handful of other people around the world noticing the same thing at the same time. And that's where the AAVMC got involved. They received a grant from the Stanton Foundation to sort of explore this and like, why is it happening and how can we help institutions provide a range of care options? It's been amazing to be part of that group because we were really wide with our backgrounds, and it makes it, everyone brings a different flavor to the table, which has been super helpful. And just working to help institutions learn how to provide care across a range. So there's a lot of wonderful things happening out there. And there's a lot of schools that could use more resources in that area. They just, need more community and help, to get there. So it's been a fun process to do that. And we're excited to see the changes that are happening at universities. And we're actually just now starting as a group to do some research to measure, like, where are we now in the vet schools? Like, what do students feel comfortable with? And so that we know of these new things that we're trying to add, where do they go? And along the way, I got involved with a group called Open Door Veterinary Collective, where our main aim is how to teach practitioners and veterinary students how to provide access to care and spectrum of care and still remain financially sustainable, which is also a big driver of the AAVMC's group. Like, we don't want people to think that you have to give everything away to provide a range of care. Like, we know that veterinarians need to get paid for their time. They have high student loan burdens. Just the cost of living for everyone is high. So we want to have everyone gain knowledge on how you can meet people where they are and still keep your practices financially sustainable. Professionals deserve to be paid for sure. It's not as though we should be giving away everything we do, but we want things to promote more health equity and be attainable. And that's what's been really fun, is showing people there are tools to how to do this. So you can go home at the end of the day and feel really great about what you were able to do for that client-patient pair. And you feel proud of your work and you were able to get a good paycheck all at the same time. So that's, I think, been a struggle as things have gotten a little trickier. And in our profession, there's been a little more divide between the clients and the providers, as there's been frustration with fees and services and things like that. And so we're trying to dial that back to reduce the moral distress of our profession, provide more care options, and keep everything more. So we're going to stay in it. Eventually, those of us that have been doing it for a long time, we want to retire. So we need we need the next generation to come along and be as enamored and in love with the profession and feel that they can pay their bills as they go. I mean, that's the ultimate goal. Be like, this is the coolest job. I can pay my bills and still meet clients and patients where they are. So we're working on it.
Right. You painted that perspective very well, and there are resources, and as you said, they're long, but it's because there's so many parts to that. And it's important to also talk about, like, you can still do very well and make this a fruitful career, both as a rewarding career from a heart place, but also a financial place. And I haven't thought about this example in a little while, but there was a case that was presented at one of the Veterinary Innovation Summits. This has been at least 2 years, if not longer. And it was the same veterinarian, had 2 different clinics in 2 different parts of the city. One was a low-cost clinic, and he even designs the clinic to, you walk in and there's like a menu of items. There's like vaccines, because he knew his clients in these areas. And then his other one was more they come in, there's a lot of options. They want to do all the tech. Like that's what the pet parents
Mhm.
want. And so he has that. And they both were highly profitable practices. Like he knew how to know his clients and provide what they needed
Mhm.
and still have a thriving business. So I can be profitable. I can feel good at the end of the day that I
Mhm.
helped people of all different places that, we are making a difference in the lives of pets and the pet parents. And like, this sounds so fun. Where do I
Right.
start? And but like, as we discussed, like there's lots of moving parts. It's definitely possible. I am curious to learn about what you find out in your research on where are students currently, because
Yeah.
I love that we're starting with students, but there's
Mhm.
also people in practice that also may feel uncomfortable doing a lot of different things in practice. They may still heavily refer, and that there's potential resources for all of those scenarios. So, do you mind sharing a little bit about what you're working on, the resources that are currently available, and then maybe the next few things that you're really excited that might be coming that people can look forward to?
Happy to share. There's a few different kind of categories of resources. As I mentioned at Open Door Veterinary Collective, we're a nonprofit group designed to develop resources for practitioners and for veterinary students. And so we have everything from just kind of learning about what spectrum of care is about to short learnings on, spectrum of care approach to canine heartworm disease that we just co-produced with the American Heartworm Society. So kind of taking those guidelines and then making them actionable and providing a range of care options for prevention, diagnosis, and treatment of heartworm. We have courses on parvovirus management, pyometra, urolith, and we're coming out with more. So those are very actionable and designed for practitioners to have resources they can use right away as soon as they take them. And they're done in a really, I think, a fun way where we include a lot of subject matter experts and really interactive technologies that go well beyond my ability to be the ones to create those. We have our educational specialist who brings in all the cool technologies which make the learning really interactive and has been shown to make it sticks more, right? Like if you are exposed to the content in different ways. So that's been really fun. And Open Door will have a membership coming. And then the AAVMC, the Spectrum of Care, they have an implementation strategies guide, which we briefly touched on, which the group that I've been involved with that took us, I don't know, about a year and a half to develop that. And it's a really broad guide, which although it's designed mostly for schools, I think it's an excellent thing for practitioners to know about because it's really cool to see what is being introduced in the schools, which is honestly what a lot of practitioners are doing. But we're trying to encourage the practitioners to feel proud of what they're doing. Like you are doing this amazing spectrum of care work. And now the students are learning about that before they get to your practices. And that's awesome because now there are terms for it and there's research behind it. And we have evidence-based protocols. And there are specialists who are saying that this is a great option. So I think even though the guide is, academic focused, there's a lot of different things that practitioners could pick out of there. So if you go to that guide on the AAVMC's Spectrum of Care Initiative site, I encourage you to look through the table of contents and look for something that resonates with you, what your practice needs, or what you feel you want to just get a little more information about, and use it in bits and chunks. It can be a little overwhelming if you try to do the whole 140-page document, but there's a lot of actionables in there. It's the same way with the open door content. Like pick something that you think is going to work for you. If you need your ACE, you might do one thing. If you just want a quick micro learning about evidence-based pyometric care and you want to get that done in 15 minutes or less, we have those too. So we tried to make it so the content in all of both guides, the spectrum of care guide and the open door stuff, which actually is partly recognized within the AAVMC's guide, is usable for all different folks. Like everyone's going to have a different need and a different interest. And so I think the more content that's out there, the better. And we have colleagues that are doing great things too. So it's not like we're the only game in town. It's been super exciting to see more and more publications coming out. Some friends from Canada just published a spectrum of care toolkit that's in JAVMA, and there's a value matrix guide about guiding it's also in a JAVMA article. I've been excited and a little bit concerned about the rate things are coming out because we're trying to make sure we stay up to date on all of it. But it's honestly, it's just plain old exciting because people are starting to realize that if you look at it as patient-specific care and you stop calling it spectrum of care, then it resonates with everybody. Like everyone's like, well, of course we should have it be specific to the patient and then their client, that goes with them. And that's what we're hoping for in good medicine. So if coming up with patient-specific care that feels good for client, patient, provider can start to replace the quote unquote gold standard, I'll feel that we've done something, because I think the highest technology option that suits some people, and that is patient specific care for some, but not for everybody. So I think we just need to rethink what success means and, kind of, like we said, keep going back to that challenge based way of getting to things.
Yeah. And a couple of things I want to make sure that we hit on. One, these resources are for so many individuals, whether they're schools, students, people in practice. And when I say people in practice, not just veterinarians. I think this is a team effort. This is something that you and I talked about earlier too, where this is something that we as a team, I think, need to embrace. And one of the most powerful things that you and I think, talked about is around, critical thinking is important. We talked about the challenge mindset of seeing it's not necessarily one right answer. It's looking at everything as a challenge, an opportunity, like how can we go in this? But the other thing is around our attitude. And we talked about being able to learn empathy and not be judgmental, right? And the reason why, again, I think this is so important is, one, important to spread that across the team, because we need to make sure that everyone is in that mindset to kind of keep us accountable and keep us in that positive, open mindset, because you never know. You may not have known that nurse just lost her job, or you don't know what is going on in these people's lives. It's human nature to kind of fill in the gaps, but to make sure that we keep that mindset, because I think it is so important for our own mental health. If we don't assume, if we are empathetic, if we're not judgmental, that we're going in with curiosity. And I think that is just a powerful tool, beneficial for everyone involved.
I really agree with that. And I love how you phrase that, because I know we talked about that before, because we coach the students a lot about approaching every situation with curiosity and without assumption. And if you do that, like you mentioned, A, it's just healthier, and B, it's so much more fun, and you're gonna be able to create care plans, diagnostic plans that work for that client, patient, provider trio. You can come up with something for everyone, and you might be surprised what that something is. But if you approach it that you have no judgment of past decisions, care options, opportunities, but just like, I'm so glad you're here today. Let's talk about what your goals are and what I can do to help you. And even if that list of things that you can do to help is more limited for some clients, that's okay. We just need to rethink what excellence means. And excellence, I think, means finding a good fit for that client-patient pair in the moment. So I think the potential for practitioners and the whole team, like you mentioned, to feel better. So starting from the front desk, if the CSR approaches like, I am so glad you're here today. Even just starting the money conversation early, would you like to hear about payment options we have available at our clinic? Like right out of the gate, so it's not like, oh, I'm so shameful about the money talk. Nope, our open door courses are coaching people on everyone needs to start to get comfortable about talking about finances, because it's just the elephant in the room. And you'll just feel better to talk about options rather than you get all the way to the end of the exam and then the estimate's presented the first time and then that's the first time it comes up. That's way late, because then there's a lot of anxieties often built up by the client versus, if it comes about with no shame. We're trying to take the shame out of it. And I bring it up as like when you go to the orthodontist, there's money talk right away, but in a non-judgmental way. Like, here are the general costs for the braces, and we have this pay over time and this pay up front. And do any of these interest you, or would you like to look at something else? And it's not just like, ooh, you can't pay at the time of service. Like that's bad. It's no, that's not bad. Let's just talk about options, So I think taking the shame out of that, having the whole team really embrace that mentality of, I'm so happy you're here today. What can we come up with together that's going to work for you? When we go out after work, it'll be for fun rather than commiserating together, And not to say that everything's going to be, rainbows and unicorns, because there always are going to be hard situations. So just finding ways to handle those in a healthy way too are really helpful. We actually have a full-time social worker on staff at Open Door, and so we're working to create content for veterinary practices on social work related solutions. Like if you don't have a social worker at your practice, which most of them don't, we would all love to have that, but we don't. So like tools that you can use for your whole staff to de-escalate rough situations, all kinds of things, everything from dealing from euthanasia to dealing with a client who's upset about A, B, or C. And so we're in the middle of working on that. So practices have more options because our job is hard, right? I mean, you can have all the challenge base and all the financial options, but still there are going to be hard days. So if we can come up with healthy ways and easy ways to deal with them, it can't be like, oh, I've got to take this 12-hour CE course to learn how to manage it. Like, no, we're going to give you some actionables that you can use today. And if you want to take the 12-hour thing course, great, if it exists somewhere, but there needs to be a range of choices for your care team to use little tools and tricks that can help them feel good at the end of the day. So I love that that's all being considered in spectrum of care, the health of the provider too, and how we need to keep working on that and how we can stay happy.
Yeah, I mean, going back to the mindset of curiosity, taking care of ourselves so that we can show up and be not worried about eating or going to the bathroom or something like
Yeah.
that. Like those things will impact our conversation with the owner. Being able to be more curious and open with the owner builds better relationships with people, which are often the things people say drive them nuts, are the relationships with the pet parents. And so if we can work on those components, that's, starts to solve these little things. And I say little, they're not little, but these
They add up.
things that add up and make it hard to enjoy our job. And we can't do our job, right? So I love that there's a holistic approach. Like you said, that there's so many different experts that are coming together with their unique color, I think, is, as you said, that is building a lot of very practical resources for people. And like you said, I think there's a focus here. A lot of people are leaning in. And so not to be overwhelmed by the options, just pick one, and start to learn and build these tools. I'm also excited for what you are doing. So I'm very excited to share this with everybody.
Amazing. Yeah. I love that you mentioned just the pick one, because any new skill development can be overwhelming. And so we often encourage people just to pick one thing that resonates with you and try that with your whole team at work today, or even just start with you and then spread it out to your team once you feel comfortable, because change is hard and we get that. But if you start slowly, I think you'll be amazed at how you start to feel. And if our clients feel better, we feel better, because that's going to reflect back on you. So, and then of course we always want the patients to feel better because we're all, in it for the animals first. So I think that's going to be a win all around.
Absolutely. And I always love to end the podcast with asking about gratitude. So what is one thing that you are really grateful for that comes to your mind?
I'm so grateful to have the opportunity that like you and other groups like you are interested in talking about this. Honestly, on a professional level, that's what I'm very grateful for, is that the topic is becoming more widely something of interest. And then in general, I'm really grateful for my human and animal family and how they put up with me and make me smile and laugh every day, even when the stuff that sometimes I'm working on is hard, because making change is hard. But they keep me laughing, keep me adventuring, and that's what truly matters. And so we want all the practitioners out there and teams to know, like, we get that you're going to focus on what really matters too. Don't spend all your time learning about veterinary medicine, because we're all grateful for those other times. And that helps to recharge us and refill our buckets so we can go back again. So mostly I'm grateful for that.